Good evening to all. Today we will discuss about the DSA exam some questions. Our first question is a client has developed atrial fibrillation and has a ventricular rate of 150 beat per minute. The nurse should assess for client 4. Actually, when patients suffer from the any type of the fibrillation or any changes in the rhythm, and when the rhythm are increased from the normal, actually normal heart rhythm or normal heart rate is 6200. 6200 beat per minute are the normal heart rate. If the our heart rate is reduced below the 60, then this is known as a bradycardia. And if our heart rate are increased more than 100, then this is known as tachycardia. Tachycardia. Okay. If the our heart is not working properly, means there in the heart there is any type of the fibrillation like condition, means there is a more foci are present and they control the our heart beat, and there is no proper pumping of the blood, so there is no proper cardiac output by the heart. So there is a reduction in the BP, means the patient suffer from the hypotension like condition. Flat neck vein are the condition seen in the hypovolemic condition. When the volume of the blood are reduced in your body, then there is a flat neck pain like condition. And nausea and vomiting are not especially seen in the cardiac disease, so this is the wrong answer. And hypotension and dizziness are seen when the your heart is not properly pumping the blood, means there is no proper cardiac output by the heart, then there is a condition of the hypotension are arise. And hypotension may lead to dizziness because proper blood is not pumping, or proper there is no proper blood that are reached to your brain, so there is a dizziness condition also seen. Hypertension conditions not seen here, because the hypertension condition seen when the fluid volume are excess in your body, and when the more blood are pumped in your blood vessels, so then hypertension and headache are seen. So here the right answer is hypotension and dizziness. If examiner asks the cardiac output, what is the cardiac output? Cardiac output. So cardiac output is a heart rate multiplied by stroke volume. What is the stroke volume? Actually, stroke volume are the volume of the blood that are pumped by the heart in a one single contraction. When your heart single time contract, then the volume of the blood that are pumped by the your heart is known as stroke volume, and the normal stroke volume is 70 ml. Actually, in a 1 minute, your heart is contract 6200 time, means this is a your normal heart rate. This is your normal heart rate, means 60 to 70. Sorry, 6200. And average is a 72 is a normal heart rate of your heart. So you multiply with this and you calculate your cardiac output. So here right answer is hypotension and dizziness, and cardiac output means the output of the heart in a per minute, means when your heart contract in 1 minute, then there is a volume of the blood that are pumped by your heart is cardiac output. When your heart contracts single time, then the output of the blood is known as a stroke volume. So this is a question, and I hope you understood. Next question is, a client has just been admitted to the emergency department and chest pain. Serum cardiac enzyme level are drawn, means your blood tests or serum cardiac enzyme level are testing, and the result indicate that elevated serum creatinine kinase level, troponin T level, troponin I level. The nurse conclude that these results are compatible with what diagnosis? Actually, these all criteria are checked in the MI patient, myocardial infarction patient. In the myocardial infarction patient, the level of the creatinine kinase, troponin T, troponin I, myoglobin, these marker are increased in the MI patient. If examiner asks that which cardiac marker or which cardiac enzyme is elevated firstly, then your right answer is myoglobin. First marker that elevate during the MI, right answer is myoglobin. But if examiner asks that more specific marker of MI, then your right answer is TROP-I. TROP-I is the right answer when the examiner asks about specific marker. This is a very close marker of the MI. So here right answer of this question is MI. New onset of myocardial infarction is a right answer. Okay. Then next question is, a client is experiencing acute cardiac and cerebral symptom as a result of excess fluid volume. Which nursing measures should the nurse implement to increase the client comfort until the specific therapy is prescribed by the primary health care provider? Actually, here examiner not ask the sign symptom of excess fluid volume in your body. Examiner asks that what you do when the excess fluid volume in a patient body till the primary healthcare provider prescribe specific type of the therapy to compete with excess fluid volume. So when the in our body there is a fluid more fluid volume or excess fluid volume in your body, then you actually what happen, actually there is a more collection of fluid in your body, so there is a collection of fluid in lungs also. So patients suffer from the dyspnea. So to reduce the dyspnea condition, the head elevation is required of this patient. So always remember in the any respiratory condition, then when the patient feel dyspnea condition, then the better position is the elevation of head. So right answer is elevated the client head to at least 45 degree. Administer oxygen at the 4 liter per minute by the nasal cannula is why not the answer here, because oxygen considered as a drug and oxygen not be administered without the prescription of the healthcare provider, means by the when the physician order, then you can administer the oxygen. And in the emergency situation you can also administer, means staff nurse can administer the oxygen, but 1 to 2 liter per minute, not more than 1 to 2 liter per minute. And in the option there is a 4 liter per minute, so this option is wrong. And right answer is elevated the client head of the bed or head at least 45-degree angle. Then next question is, a client is experiencing pulmonary edema as a exacerbation of the chronic left-sided heart failure. The nurse should assess the client for what manifestation? Actually, when the fluid are accumulated into your lungs, then this is known as pulmonary edema. And in the pulmonary edema, there is a coughing, pink color sputum, dyspnea, and when you hear the lung sound, then crackling sound. Crackling sound arises when the oxygen or air is traveling by the fluid, because here is a fluid accumulation in the your lungs. So when air passes from the lungs, then there is a sound creation, and this sound is a crackling sound. So these are the sign symptom of the pulmonary edematous condition. So weight loss is not a sign symptom of the heart failure, because in the heart failure condition there is a accumulation of the extra fluid in your body. If the extra fluid accumulate in your body, then there is a increase in the weight, not reduce in weight. So right answer is weight gain, not weight loss. Bilateral crackling sound are seen. Distended neck pain. Distended neck pain are the sign symptom especially for the right sided heart failure, not for the left sided heart failure. So I hope you understood this question, that examiner asked the left sided heart failure. So here answer is a bilateral crackling sound. Next question is, a client is diagnosed with thromboangiitis obliterans condition. The nurse places the priority on the teaching the client about the modification of which risk factor related to this disorder. Actually, thromboangiitis obliterans is the disease is known as Buerger disease, and this is a peripheral arterial disease. Peripheral arterial disease. This disease is caused by when the patient smoke. Due to smoking, there is a contraction of small vessels. So, if the contraction of small vessels, so the blood supply is interrupted due to narrowness of the lumen of these small vessels. So, this disease is especially related, or the risk factor for this disease is smoking. So, we see the options here. The options is exposure to heat, cigarette smoking, diet low in vitamin C, and excessive water intake. So right answer is cigarette smoking. Cigarette smoking can lead to the thromboangiitis obliterans, means Buerger disease. Next question is a client diagnosed with the heart failure and secondary hyperaldosteronism is started on spironolactone. To manage this disorder, the nurse informed the client that the need for the dosage adjustment may be necessary if which medication is also being taken. Actually, here patient is suffering from the heart failure, and in the heart failure condition, there is a accumulation of the fluid in your body. So, to reduce the this accumulated fluid or to excrete this fluid, there is a medication that are prescribed is spironolactone, and this spironolactone is a potassium sparing diuretics. This is a potassium sparing diuretics. Spironolactone is a diuretic medication that spare potassium, means this medication preserve the potassium and excrete the other content like other minerals or water. So there is a excess accumulation of the potassium in your body. The nurse informed the client that need for dosage adjustment may be necessary if this medication is also being taken. So alprazolam, warfarin sodium, potassium chloride. If patient already taken potassium chloride, so here is a chances that patient may suffer from the potassium toxicity, because spironolactone also spare the potassium and patient already taken the potassium chloride. So there is maybe chances to more potassium accumulate in your body. So the patient suffer from the potassium toxicity. So here is a dose adjustment is required in this condition. Okay. Next question is this. The nurse analyzed the electrocardiogram step for a client demonstrating left-sided heart failure and interpret the ECG step as which rhythm. Actually, a normal rhythm of the ECG like this. What is this? This is a P wave. P wave always denote the atrial depolarization. Means when the your heart atrium contract, then there is a formation of P wave. When your ventricle contract, then there is a formation of QRS wave. And during the repolarization of ventricle, there is a T wave. If you see in the diagram or ECG strip, there is a special normal QRS seen in every time. But here is a P wave look like the fiber like wave. P wave is not especially seen or clearly seen in this ECG. And in this ECG, P wave look like fibers. So this is a P wave problem, means atrial problem, and this condition, if the in the P wave there is a fiber like appearance seen, then this condition is known as atrial fibrillation. So here this is a atrial fibrillation condition. And next question is endometrium of pregnant uterus is known as. Actually, in the uterus there are the three layers are present. First layer or outermost layer is known as perimetrium. Middle layer is known as myometrium. And innermost layer of the uterus is known as endometrium. Endometrium is the layer that are breakdown during your menstrual cycle, and due to the breakdown of the endometrium, there is a blood loss. And endometrium is the layer where the your placenta attached, okay, during the pregnancy. And myometrium layer are the muscular layer that is play major role in your contraction during your labor. So this is a myometrium. Myometrium is a middle layer, and this is the strongest layer of the your uterus. And if the female is pregnant, then this endometrium is also known as decidua. Means pregnant uterus endometrium is known as decidua layer. So right answer is decidua. Actually, amnion and chorion are the fetal membrane that surrounding the fetus in your uterus when the mother is pregnant. Trophoblast are the layer actually when the blastocysts are divided into portion inner cell mass and outer cell mass. The outer cell mass are known as a trophoblast. From the trophoblast, this trophoblast divided into two portions, syncytotrophoblast and cytotrophoblast. These form the your placenta or villi formation from the syncytotrophoblast. Okay, and from the syncytotrophoblast there is a release of HCG hormone that you see in urine or blood for the detection of pregnancy. Next question is, what is the proportionate weight of baby to placenta at term? At the term, the baby normal weight or average weight of baby is 3000 gram, and the placenta weight at the term is 500 gram. So the ratio is 1:6 ratio bin. But if an examiner asks in opposite, that placenta and baby ratio, then your answer is 1:6. I hope you understood this session, you enjoying this session, and we meet tomorrow also with new questions. Thank you so much for watching the video.